Many women are curious about the early signs of pregnancy before a missed period, and it is common to think that a missed period could be an indication of pregnancy. However, there could be some earlier signs that your body could actually be giving you even before you notice that you have missed a period. We are going to dive into those signs so that you can have a better understanding of what to look out for. But remember that everyone has a different experience, and I would love to hear about those unique signs that you experienced in the comment section. Let us have a quick overview of what is happening in your body during early pregnancy. After conception, your body undergoes several hormonal changes, primarily due to the increase in the HCG, estrogen, and the progesterone. These hormonal shifts are what causes the early pregnancy signs that women notice before their missed period. And what you have to remember is that not all women are going to experience these symptoms. And also, these symptoms are sometimes confused for premenstrual symptoms. So, with that being said, let us look at some of the common signs of pregnancy before a missed period. And the first point is implantation bleeding or spotting. So, implantation bleeding can be one of the earliest signs, and it occurs when a fertilized egg attaches on the lining of the uterus. So, the bleeding is a little lighter than your regular period, and it can be pink or brown, and it lasts for a few days, but this varies from person to person. So implantation bleeding typically occurs 6 to 12 days after conception. So if you notice any light bleeding during that time, it could be a sign. So just watch out for any lighter flow and a different timing. Some women might experience mild cramps or abdominal discomfort as the embryo implants in the uterine lining. So these cramps could be lighter and shorter than your regular menstrual cramps, and you will feel like a dull ache or a pulling sensation in your lower abdomen. So if you are expecting your periods and then you feel cramps that don't normally feel the way that your menstrual cramps normally feel, this could be a clue that you are actually pregnant. You'll also notice changes in your breast. So hormonal fluctuations normally cause your breast to feel tender, swollen, and heavier. And also some women will notice that the areola, that is the area around the nipple, becomes larger and darker. So these changes happen as the body starts preparing for pregnancy. Then we look at fatigue. Fatigue is another common sign of early pregnancy. This is because the progesterone levels rise rapidly, making you unusually tired. So if you're like a healthy lady, you don't have any underlying causes, you don't have any problem with yourself, and then you find yourself unusually tired and you have a need to nap, and then you're also tired throughout the day, and you have been having unprotected sex, this could be a sign that you're actually pregnant. So what you have to do is to just listen to your body and take enough rest. Then we have nausea and vomiting or morning sickness. So nausea with or without vomiting is a common sign of pregnancy in women. This is brought about by smelling certain odors, eating certain foods, and it can also be triggered by hormonal changes. So morning sickness normally occurs in the first 3 months of pregnancy and starts before 9 weeks. But there are some women that experience morning sickness or nausea and vomiting throughout their pregnancies. So you've had some women complaining about vomiting throughout their pregnancy, which is not good. I'll talk about it in my next video, I think, danger signs of pregnancy. I think I'll discuss it in my next video. And what you have to keep in mind is that this nausea and vomiting can occur during the day or night. Some women will also notice changes in their cervical mucus, so it becomes more thicker, creamier, and more abundant due to the increased blood flow and hormonal changes. So in addition to the changes in the cervical mucus, women who are familiar with checking their cervix will notice a change in its position and the texture. So during early pregnancy, the cervix normally becomes softer and higher in the vagina. While this is not a definitive sign of early pregnancy, it should be accompanied by other symptoms. So you have to notice the implantation bleeding, there may be some cramping, fatigue, mood swings, increased urination, but it is not only that. You have to look at the cervix and you're like, I'm pregnant. This is a sign of early pregnancy. No, it should be accompanied by other early signs. Then we go to increased urination. So as your body is adjusting to the pregnancy, you will notice a need to urinate more frequently. This happens because pregnancy increases the amount of blood in your body, which means that your kidney will need to process more fluid. And also the growing uterus puts pressure onto your bladder. That is the reason why when you go further into your pregnancy, you're going to have more urge to go and urinate, because the baby is putting pressure onto your bladder. So that is the reason why pregnant women tend to urinate a lot during pregnancy. Then we also have mood swings and emotional changes, which occur due to the hormonal shifts in early pregnancy. And the hormones estrogen and progesterone normally increase during pregnancy, which cause mood swings. These hormonal changes normally affect the neurotransmitters, which are brain chemicals that regulate the mood. So a person is going to feel emotional, sensitive, moody. In fact, someone is going to be like that on an emotional roller coaster, from feeling extremely overjoyed to feeling sad, then they are crying, they are stressed. These are some of the signs that women normally experience before they start their period. But when it comes to pregnancy, this is another different level. A person is going to be moody, the person is going to be so sensitive, they're going to be so emotional. So you hear some men saying, omukazi nga ayomba nnyo ennaku zino, omukazi nga ayina essanyu lingi, ate tubeera ate natandika okukaaba. Like, you are on an emotional roller coaster, and this is a common sign of early pregnancy. Then you go to the basal body temperature. Tracking your basal body temperature can give you a clue. Now, a consistently elevated body temperature, even after ovulation, could be a sign of early pregnancy. This is because the progesterone levels remain high during pregnancy to prevent the uterine lining from shedding and also help the fertilized egg to implant. So apart from the signs and symptoms that I've discussed, a woman can also experience dizziness due to the hormonal changes that affect the blood pressure. And also some women experience that metallic taste in their mouth. Now, this is not for every woman, but those ones who do experience this could be a hint that you may be pregnant. And then lastly, there is constipation and bloating. This is because the progesterone hormone slows down the digestive system, which causes changes in your bowel habits and also a bloated feeling. Now, it is important to note that just experiencing all these symptoms and signs that I've spoken about cannot confirm that you are pregnant. And a lot of these signs are sometimes confused for the premenstrual symptoms or some medical conditions. So the only way that you can confirm that you are pregnant is by doing a pregnancy test. Let us talk about the best time for you to take a pregnancy test. Because typically ovulation occurs 14 days before your next expected period in your regular cycle. So if you have like a 28-day cycle, ovulation is going to occur like on the 14th day. If you have like a 21-day cycle, ovulation normally occurs like on the 7th or 8th day. After ovulation, if conception has occurred, the egg is going to travel down the fallopian tube and implants in the uterus about 6 to 12 days later. So this implantation triggers the production of the HCG, which has to be detected by the pregnancy test. So what I would recommend about taking the pregnancy test is to wait until the first day of your missed period, because the accuracy increases as the HCG builds up. If the HCG has not built up, you may take the pregnancy test and it is going to come back negative. If the HCG has built up during that period, that means that when you take a pregnancy test on the first day of your missed period, it will come out positive. Thank you so much for watching. If you found the video helpful, do not forget to like and share it. Don't forget to subscribe and hit the notification bell so you don't miss out on any of the videos that I post. I'll see you in the next discussion. Have a good one.